Stretch marks, as the name suggests, are stretch marks. So they happen when there is a rapid weight gain or sudden weight loss or even rapid gain in height in individuals. So quite common, amongst 85% of us have it, and it is predominantly on the fat rich areas of the body like buttocks, breast and thighs for women, abdomen post pregnancy, and abdomen and upper arms in men. It starts as a red streak that is slightly elevated, and then it is known as stria rubra. Over a period of next few months, it turns into that porcelain white streak, which is then known as stria albicans, and this is going to persist for the rest of your life, and it is like a scar. So most of the treatments for stretch marks are related to the scar treatments like microneedling, PRP, vampire therapy, and even fractional laser, be it ablative or non-ablative. The best form of treatment is prevention, but easier said than done. If it really bothers you, first and foremost, you should keep this in mind that it's completely normal and all of us have it, even the celebrities have it. And all those figures that you see on tabloid media are the result of Photoshop. But if it still bothers you, there are treatments available and you can take those in order to get the desired result.